My name is Lohanga Musumadi. I'm an advanced nurse practitioner for sickle cell. I work here at Guy's St. Thomas's Hospital, which includes the Evelina Children's Hospital. And basically, I manage the transition service for young people with sickle cell and thalassemia, supporting them through as they prepare to leave the children's environment into the adult services. I was employed to set up the service in 2008, and my post was the first of its kind really in the United Kingdom within haemoglobinopathies. A hospital audit had been performed prior to me starting, and it clearly identified the need for the service being set up to support the young people as they moved from the children's hospitals into the adult services. Before, it was very much we did have a clinic, but it was very much an administrative event where the young person turned 16 and they were transferred to the adult services. So it was quite upsetting for some young people, and occasionally that led to patients disengaging altogether with the services, predisposing them to quite serious complications. I worked with a clinical psychologist to identify the key issues. We also consulted with other key stakeholders, and these included the pediatric as well as the adult clinical leads, and also our colleagues in the community. We developed the patient pathway, the clinical protocols to provide clinical guidance, and also assessment tools, and as well as information leaflets for patients to really inform them about the service, but also to support the clinical staff on how to access the pathway and provide the service that was required. We start the transition service at the age of 12 to 13 years old, and we use what we call a passport questionnaire, which provides sort of a structured way of addressing all the issues that are pertinent to this age group. And at that point, we sort of continue to see them for the rest of that 3-4 year period up until the age of 16 to 17. Typically, medication adherence is quite a big issue, as well as attending hospital appointments. But the way we address the difficulties with medication adherence is really making sure that we go through the information with the young people from early on. They understand what the medicines are, the dosages, and really explaining why they're taking these medicines. If taking medicines sort of becomes a habit from early on, it makes it a lot more easier for them as they grow up to take on the responsibility of taking the medicines. The three main stages of the passport are the initial stages at the age of 12 to 13, where we do a formal assessment, and this is merely to sort of identify what they already know and identify the gaps so we can support them to sort of bridge those gaps. And at the age of 14 to 15, we do another interim assessment to sort of try and see what progress they've made since we started working with them. And finally, the final stage is at the age of 16 to 17. At this point, we would expect that they have achieved most of the objectives that we're trying to achieve in terms of their self-advocacy, their independence in taking medicines, and really being able to do things for themselves. Then we invite them to come to the multidisciplinary transition clinic. And this clinic takes place within the pediatric environment. And it's a clinic where basically we plan with the family and the young person how and when the transfer is going to happen to the adult services. Setting up a service, any service, I guess, there's the initial challenges, and then there's always the teething problems that you have to work through. But I think for us to establish a sort of successful service, I think establishing really robust communication channels between all the teams involved and all the stakeholders was really key, because ultimately our aim is to ensure that the young person is the main beneficiary, and so supporting them to gain independence with the key skills such as self-care management skills, being able to advocate for themselves, also making informed decisions about their health is really, really important. And those are the key skills that they all need to function as independent adults when they arrive in the adult services. We've had the opportunity to evaluate the service 5 years after the service was set up, and this revealed a lot of very useful information. Before the service was set up, we had lots of young people who had been lost to follow-up, for example, and clinic attendances was quite poor. But the evaluation has showed that young people are engaging more with the services as a result of actually all the time that we've invested in providing them with information about the usefulness of staying connected with the services. And in addition, the questionnaire audit which the patients filled in has also showed that their understanding of their condition and how they manage themselves has improved, and they're showing a lot more confident being able to do that on their own. I've been very lucky to work for this trust because all the clinical leads as well as the hospital management have been very supportive in ensuring that we're listening to the needs of young people and actually making adaptations to be able to suit and provide an age-appropriate service. So yes, it's been fantastic. And following a peer review of our service last year, our transition service received recognition as a beacon service, and this is a model that's being encouraged to be provided in other services up and down the country. So we're quite excited about that. If anyone wants any more information about the transition service, I'll be very happy to talk to you, and my details will follow on the screen after this. Thank you very much.